Sunday lunch at the Watsons' house is busy time,
Act like you've done this before, okay?
I am.
and it's family time.
Not me. Who decided that?
While Stephanie Watson, her aunts and uncles share a meal, they share something else. Cancer. It runs in their family. Stephanie's father died of colon cancer when he was 52. Her uncle was diagnosed with colon cancer just a few years later. And an aunt had uterine cancer.
Well, first thing that came to mind was who was next. I mean, my aunt had uterine cancer, then we have other females in the family who might be at risk. So that was the next question, was who was next and what could we do about it?
Her family shared her concerns.
Personally, for me, I was thinking, could I have cancer? Could I be at risk of getting cancer?
Stephanie's family doctor recommended genetic testing. Today, she's meeting with genetic counselor Sarah Pierce-Miller.
So yeah, when we hear histories like that in families, we start to wonder, could there be some sort of connection here? When we think about how many genes are involved, right now we know that there are 4 that are the most common, and they cause something called Lynch syndrome. I felt that Stephanie was an excellent candidate for genetic testing based on her family history that she reported. And specifically, she met national guidelines for consideration of hereditary colon cancer testing, namely a condition called Lynch syndrome.
And I thought, well, I probably should do it. I mean, I had a lot of the risk factors that she was mentioning, and so I said, you know what, it'll be good for me and my family to know.
You're going to feel a little stick.
There are 2 ways of testing, a blood test or collecting the patient's saliva in a tube.
I'm going to take all your
Stephanie chose to do the blood test.
and then we'll be done. You can go on your way.
Stephanie's results came back 2 weeks later.
So Stephanie's results showed that she had an MLH1 mutation, which is one of the 4 genes associated with Lynch syndrome, and MLH1 is one of the most common ones. It actually shows that she has up to an 80% lifetime risk for colon cancer and up to a 60% lifetime risk for uterine cancer. And then there are other cancer risks that can be elevated as well for both men and women.
Screening recommendations typically include, in the early 20s to 30s, begin colonoscopy every 1 to 2 years. At age 25 to 30, consider urine screening every year. At age 30 to 35, some patients consider upper digestive tract screening every 3 to 5 years. And at age 35 to 40, or after childbearing is complete, consider removal of the uterus and ovaries.
And we're just looking to see if there's anything inside that sticks out, like a polyp or a cancer or a mass.
So I'll need colonoscopies more frequently than the average person, and then also my risk was high enough that we also talked about maybe removing my uterus and ovaries.
This time during.
Studies show Lynch syndrome patients who follow screening recommendations can live 25 more disease-free years than those who don't follow the recommendations.
Well, it was tough. I'm not going to lie. It was tough. Looking at my own personal life and my friends and family that mean so much to me, I decided that this would be the right thing for me to do for my family, that I can go and talk to them about the choices that I made and empower them to make those life-changing decisions as well.